Hi, my name's Anna. I'm going to be administering an enema today. So I would make sure that I have all of my supplies in my room. I went ahead and put them in Sims position just because it was going to be hard to do so. But you can put them on either side with the Sims position, but the left side is preferred. So I would go ahead and perform hand hygiene. And I went ahead and filled up my bag here. It is 105 to 110 degrees Fahrenheit. If that were to happen, I would get a new one because it is dirty. Then I can go ahead and put in my soap packet. The amount of water that you put in here will depend on what your provider prescribes. And this soap is to lubricate your bowels and get things moving in there and act as lube. So I put my soap in there, and then I do not want to shake up my bag. I just want to gently move it around, because if I made bubbles, that would act as air and it would not work correctly. So then I can hang it up. Hang it up here, and I would prime my tubing, which I would just unclamp this, and then until water gets to the very bottom. And then I would go ahead and put my bed up to working height. And then make sure that my patient is covered. I would use a towel or sheet to cover up the top half, just making sure very little is exposed. And then I would go ahead and lube this up. There is already lube on the end of your tube, but not enough. So I would start down low, and then I would insert the tube 3 to 4 inches, and then while inserting, I would have my patient take a deep breath, tell them that they're going to feel some pressure, and then I will slowly raise up the bag. And if the patient complains of pain, says they cannot tolerate it, then I would lower the bag. If the patient complains of cramping or pain, you can stop, have them flex their anal sphincter so that it relieves pressure. And then I would instill this into the bowel, into the bottom, for 5 to 10 minutes, or as provider says. And then when taking out, I would tell them that to take a deep breath, and then I would remove it, put this in a biohazard bag, and then I would clean them up, make them comfortable. They would continue to lay in the Sims position for 5 to 15 minutes, and I would make sure that there was either a bedpan or a bedside commode near them, along with their call light.